Firuz, you talk about health guardianship, and one of the things that you talk about a lot is that it's more than just getting a quality group of integrated nurses, specialists, primary care physicians together. It's about getting people that are dedicated to delivering service above and beyond their role in the traditional sick care system, but guardianship is more than that. Can you talk about that?
Sure. I believe that is in the DNA of every doctor and nurse when they go through their training, long training, to help people, to make them healthier. Again, the defining question is, how can we deliver better health outcomes? So we identify the best of the best in their field who have become frustrated from the sick care system. And inside the Bowtie Health Guardianship, they find a space to express their DNA. This is where they can be very proactive. Rather than waiting for the heart attack or the chest pain happen, they look at the health risk of our members, say, how can I prevent this from happening? So that is really the magic of the health guardianship. People who are best at their job, bring them inside in a space where they can do the best they have with their knowledge to prevent the health events from happening and therefore reduce the risk for unnecessary care and reduce the cost from unnecessary care.
And unlike in the sick care system, you're encouraging those guardians to spend the time proactively, to actually work proactively with members even more than they would be in a traditional sick care environment.
100%. Again, to us, the name of the game is the risk mitigation. It is our job to identify our members' health risk and put processes, protocols, care plans in place to prevent those health events from happening. My motto is, I don't want our members ever becoming a patient. And that is the driving force for our health guardianship.
How do you believe that you can achieve members not becoming a patient? What does that really mean?
It's again, scientific statistical concept. When there is a risk for an event, a health event, obesity, diabetes, heart attack, and so forth, you have two choices. You can wait for the event to happen, like in a bow tie, and deal with the consequences. That's the sick care model.
The consequence being the knot in the middle of the bow tie.
Correct. Or you can basically gather as much information as you can from the person, monitor their health progress and so forth, and mitigate the risk and delay or prevent that from ever happening. Scientifically, now we know more about the risks of the chronic conditions, obesity, diabetes, cardiovascular, frankly, than we know how to treat them. We cannot cure these conditions, but by God, we can prevent or reduce them from happening.
I know one of the pet peeves that you talk about is the sick care's use of the word prevention, and that it's not really focused on preventing the event leading to the event.
What is the commonly used or abused, the prevention is basically screening for the symptoms or the markers that have already begun, and therefore use that as another vehicle to drive more services, more sick care services. The risk mitigation is realizing the health risks exist in front of all of us. What are the things we can do to prevent those symptoms or those events from happening ever again? And again, we have scientific knowledge how we can prevent or eliminate obesity, diabetes, cardiovascular. We just don't have financial institutions. We don't have institutions who financially would benefit from eliminating those in the individual or the people. Whereas we have financial institutions called hospitals that they benefit from those events happening and therefore delivering their services.
If it was truly about prevention, there wouldn't just be magically millions of dollars at the end of each one of those tests that we were uncovering.
Correct.